Have you ever reached for an antacid and still felt that burn? Hey everyone, welcome back to Alpha Health Lab, your go-to source for science-backed health solutions. Today we're diving deep into heartburn, indigestion, and GERD, topics that affect millions worldwide and generate over $10 billion, 0 cents in antacid sales every year in the US alone. We all assume acid reflux and heartburn mean too much stomach acid. But is that really the case? By the end of this video, you'll understand why most sufferers actually have too little acid, not too much, and exactly what to do about it. Let's dive in. Comment "I'm in" if you're ready to uncover the real cause of your heartburn. Bonus insight. Many viewers tell us they've tried every quick fix under the sun, herbal teas, chewing gum, breath mints, but still wake up with that nagging ache. Stick around and you'll discover why those tricks only mask the symptom without addressing the real problem. 1. Where do you really feel heartburn? Most people picture a burning sensation in their stomach, but true heartburn usually ignites higher up. The pain and warmth you feel are caused when stomach contents splash against the delicate lining of the lower esophagus. This tissue isn't designed to handle even modest acidity, so the moment acid or partially digested food makes contact, you feel that unmistakable scorch. The key player here is the lower esophageal sphincter, LES, a circular muscle at the junction of your esophagus and stomach. When functioning properly, it opens to let food pass down, then snaps shut tightly to keep digestive juices where they belong. But if the LES is weakened or mistimed, even a small amount of acid can seep upward, resulting in that chest-aching discomfort. Scientists believe that nerve endings in the esophagus are up to 1,000x more sensitive to acid than those in the stomach. So what feels like intense burning may actually be just a few drops of acid. That's why even low-level acid exposure feels like lava creeping up, or a hot knife slicing through your chest. I've personally talked with dozens of patients who describe heartburn as feeling like a flaming arrow lodged behind the breastbone. These vivid accounts underscore just how aggressive even minimal acid contact can feel when the LES barrier fails. Comment "upper burn" if you felt the burn in the wrong place. 2. Why low stomach acid causes reflux? It sounds counterintuitive, but inadequate stomach acid, known clinically as Hypochlorhydria, is a major driver of reflux. Beyond breaking down food, stomach acid also triggers a hormonal cascade that signals the LES to clamp shut. When pH drifts upward, weaker acidity, the LES misreads the signal and may stay partially open, allowing backflow. Research in digestive diseases and sciences showed that patients with hypochlorhydria experienced reflux symptoms identical to those with acid overproduction, and that prescribing PPIs, proton pump inhibitors, often backfired by further suppressing acid and weakening LES function over time. When acid is too low, digestion stalls and food lingers in the stomach. New meals press on the backlog, generating pressure that forces contents upward, much like overstuffing a suitcase until the zipper bursts open. Without robust acid to break items down, that spillback becomes heartburn. Anecdotally, many Alpha Health Lab community members report that once they restored their acid levels, the nightly reflux and chest pressure they'd endured for years simply vanished. No more expensive antacids, no more sleepless nights. Comment "close my valve" if you want to strengthen your digestive barrier. 3. Age. Acid and the pH connection. Stomach acid production peaks in adolescence and early adulthood, then gradually declines, often by as much as 50%, by your 50s. Many chalk this up to normal aging and mislabel the discomfort as mere indigestion, never suspecting a chemical shift in their digestive environment. A healthy gastric pH sits between 1 and 3, strong enough to denature proteins, dissolve minerals like iron and calcium, and kill invading pathogens. Once pH creeps above 3, that unraveling power fades. Proteins remain partially intact, fermenting in place and generating gas that increases intragastric pressure and nudges the LES to surrender. Think of it like cooking on a low flame. Your food takes forever to cook, while the heat you do produce leaks away inefficiently. I remember when I turned 35, my once routine post-meal latte would spark hours of discomfort, proof that just getting older isn't a reason to accept heartburn as inevitable. A large-scale survey in the Journal of Gerontology confirmed that nearly 40% of adults over 60 display markers of hypochlorhydria, yet only a fraction ever learn it's the true root cause of their digestive pain. Comment protein power if you want your stomach back at pH 134. Hypochlorhydria vs. Achlorhydria. Not all acid deficiencies are equal. Hypochlorhydria describes pH levels between 3 and 5 some acid but not nearly enough. Achlorhydria means pH above 5 some acid, virtually absent. Both conditions produce reflux, bloating, indigestion, and poor nutrient uptake. In hypochlorhydria, incomplete breakdown leaves undigested particles that feed harmful bacteria in the small intestine. Over time, small intestinal bacterial overgrowth, SIBO, can develop, compounding gas, bloating, and discomfort. Achlorhydria takes this further, blocking mineral and vitamin release entirely. Mainstream medicine often leaps to acid-suppressing prescriptions, H2 blockers without measuring gastric pH. This patches symptoms without correcting the root cause. A simple lab or at-home test coming up next distinguishes these conditions, guiding you toward true restoration rather than suppression. It's not uncommon for patients misdiagnosed with IBS to discover they actually have achlorhydria. Once their acid levels normalize, the SIBO-driven bloating and pain vanish. Comment, restore acid if you're done masking your symptoms. 5. Health consequences of low acid. Low stomach acid ripples through every system in your body. Protein deficiency. Without strong HCl, proteins remain tangled, depriving your body of amino acids essential for muscle repair, hormone synthesis, and neurotransmitter production. Result: slower recovery, unpredictable mood swings, and cognitive fog. Mineral malabsorption, iron, calcium, magnesium, zinc, copper, all need acid to dissolve. Deficiencies can manifest as anemia, osteoporosis, muscle cramps, or recurring infections, even if your diet seems fine. Vitamin B12 block. B12 binds tightly to proteins, requiring acid to release it. Low B12 causes fatigue, neuropathy, and brain fog. Many supplement B12 without absorption. Without acid, gut dysbiosis and immune disruption. Acid is your first defense against pathogens. When levels drop, H. pylori, yeast, and parasites can overgrow, leading to ulcers, gastritis, and SIBO. Chronic infections fuel systemic inflammation and autoimmune flares. A landmark 2017 survey found that 60% of chronic GERD patients actually had low gastric acid and saw a marked improvement when their acid levels were restored, underscoring the importance of correct diagnosis over symptom masking. I once treated a marathoner who struggled with chronic fatigue and joint pain. Within weeks of correcting her hypochlorhydria, she reported back-to-back personal records and zero joint stiffness. Comment, no more bloat if you're ready to fix the root cause. 6. Why antacids and PPIs make it worse. While antacids and PPIs deliver quick relief, they carry a long-term price tag. 1. Further acid suppression. They reduce acid you may already lack, worsening malabsorption and digestion. 2. Nutrient deficiencies. Chronic PPI use is linked to low magnesium, calcium, and neuropathy. 3. Microbiome imbalance. A weakened acid barrier allows opportunistic pathogens like C. difficile and yeast to flourish, leading to chronic GI disorders. 4. Rebound hyperacidity. When you stop PPIs, the stomach often overcompensates, producing a surge of acid that can be more painful than the original symptom. It's akin to draining your home's fire sprinklers to stop a small leak. You solve one problem but leave yourself vulnerable to far greater disasters. A meta-analysis in alimentary pharmacology and therapeutics found that long-term PPI users have a 44% higher risk of developing SIBO, Comment stop suppressing if you're tired of Band-Aid solutions. 7. Simple at-home pH test. You don't need a gastroenterologist to gauge your acid levels. Try this proven DIY method. 1. Upon waking, before eating or drinking, dissolve 1/4 teaspoon of baking soda in 4 to 6 oz of water. 2. Quick sip. Drink the solution quickly and start your timer. 3. Interpretation. Under 2 minutes. Strong acid production, healthy. 2 to 5 minutes. Mild to moderate low acid, Hypochlorhydria. Over 5 minutes. Severely low or absent acid, Achlorhydria. Baking soda reacts with HCl to release CO2, prompting a burp. The slower the burp, the less acid you have. Repeat for 3 mornings to average your results. While not clinical, this screening tool correlates over 70% with lab-based pH probes in pilot studies. A word of caution: if you experience nausea or persistent discomfort during the test, stop and consult a healthcare provider. Comment test ready if you're doing this tomorrow morning. 8. Common causes of low stomach acid. Understanding why acid declines lets you target the right fixes. Age-related decline. Acid wanes after age 30 to 40. Chronic stress. Elevated cortisol diverts blood from the gut, suppressing acid secretion. H. pylori infection neutralizes acid and damages mucosa. Low sodium diets. Chloride from salt is vital for HCl. Too little limits production. Medications, NSAIDs, chronic antacid use, and PPIs irritate cells that secrete acid. Nutrient deficiencies, zinc, iodine, B vitamins are cofactors for acid production. Low levels impair HCl synthesis. Thyroid dysfunction. Hypothyroidism slows metabolism, including digestive secretions. Genetics and autoimmune conditions. By pinpointing your personal triggers, you can implement targeted dietary, lifestyle, and supplement interventions to rebuild acid levels sustainably. Comment, find my cause, if you want to pinpoint your trigger. 9. Betaine H. clay. The natural remedy. When used properly, betaine hydrochloride safely mimics stomach acid to kickstart digestion. 1. Start slow. Take 1 325 mg capsule with the first bite of a protein-rich meal. 2. Titrate up. Add 1 capsule per meal in subsequent days until you feel a gentle warmth, your ideal dose. 3. Maintain and reassess. Use for 6 to 12 weeks, then pause and retest your acid levels. 4. Combine with enzymes. If you lack a gallbladder or struggle with fats, add ox bile or broad-spectrum digestive enzymes. Always consult your doctor if you have active ulcers, GI bleeding, or stomach pain. When dosed correctly, Betaine H. clay restores digestive efficiency, reduces reflux, and improves nutrient absorption. In one randomized trial, 85% of participants reported marked relief from bloating and heartburn after 8 weeks. Comment HC Hero if you're ready to rebuild your stomach acid. 10. Beyond HCl. Valve controlling nutrients. Restoring acid is crucial, but your LES also needs direct support. Magnesium plays a starring role by relaxing smooth muscle fibers and optimizing nerve signaling. Why it helps? Magnesium deficiency is linked to less spasms, acid reflux, and even restless leg syndrome. Sources: spinach, almonds, pumpkin seeds, dark chocolate, all deliver bioavailable magnesium. Supplement strategy: 200 to 400 mg of magnesium glycinate before bed supports muscle tone, nerve health, and sleep quality. Lifestyle boosts: practice mindful eating. Chew your food thoroughly, avoid large meals within 3 hours of sleep, and elevate your head by 6 to 8 inches to let gravity assist your LES. Other key nutrients include vitamin D, supports tight junction integrity, L-glutamine, heals the gut lining, and zinc, a cofactor for acid production. Pair these with stress reduction techniques, meditation, deep breathing, or yoga, to optimize both biochemical and mechanical aspects of digestion. Comment valve control if you want that nutrient tip. Thank you for watching. Your digestive health journey doesn't end here. Keep experimenting, listening to your body, and sharing your results with our community so we can all learn together. If you found this video helpful, please hit like, subscribe, and ring the notification bell so you never miss another insight from our channel. Share this with anyone who struggled with chronic reflux. It could change their life.